Um, and I've been doing this for a long time, and the story never changes. I was in Sweden, and I thought people called me to come to Sweden. I had to go there. In those days, you could get on a plane and go somewhere to train people in what I'm doing and see how we could adapt it for use in their country. And I thought, Sweden, that's like this perfect country, right? They don't have this issue, they don't have domestic violence, and yet they certainly do delinquency, drug use, all of the things that we have here, maybe a smaller proportion, but it's everywhere. It's deep, it's old, it's not changing. And that, I mean, the same issues come up for years and years and years and years. Even the issue of the police don't help me. And what are you supposed to do? Call the police. They don't respond, they don't help. We've had that happen in Michigan over and over. One woman called 17 times. On the 18th time, she was seriously injured. Um, I'm hoping that with all the energy that comes from a conference like this, that people can urge their legislators, their community office holders to provide training for the police in this issue about the needs of kids, the needs of the responsibilities of the police, and the needs of the women in these circumstances, because that's supposedly one of our lines of defense, and yet it falls through a lot. I know a lot of trainings have been done for police departments, and it's getting better than it used to be, but there's a bit of a backslide too, given the politics, in our country at sometimes. So I would urge you to keep pushing, get these people trained, because they're missing the issue, missing the boat. And it's may take 10 times before someone is really able to make a decision to go. So I appreciated all the comments about therapy, getting the support you need. Really loved hearing too, not I didn't enjoy hearing about the pain of it, but I really appreciated hearing what service providers can do and what they cannot do in terms of being helpful, and the most important things to remember. The programs that we've been doing we take the position that the kids are the experts in their experience. These kids have been through things, they have opinions about them, they know what they want to say and what they don't want to say, and we really provide an environment for the kids where they can participate or not. It's usually fun activities for the kids, so they do just jump in. But we don't teach them things, we don't tell them things that they have to do or they need to know. We hear from this group of kids what it's like and what kids think, and some of the things kids have tried, and we can support their wishes for things to be better and help them figure out how to solve problems and things. But it comes from the people. And the same is true in the moms program. It's not prescriptive. We're not here to say you must leave the abuser, or by the fourth session you better tell us everything that happened. And we never do anything like that. It's all about support, getting together, putting heads together. And you could just see from this panel, put a bunch of women together, you are going to get some good advice. You're going to be able to share information and get support. And that's the whole idea of the program. We touch on topics that women have told us they want to talk about, and we listen. So we don't sort of teach people things directly. We don't pretend we know anything, because everybody's in a different place. And if you do this work long enough, you really get that picture. Plus, we know from all the years of experience, the variety of issues people bring, and then certainly the cultural overlay of expectations of the roles of men and women and things like that. It was interesting doing the training in Sweden, because the Moms Empowerment Program, at some point we talk about, moms have said they really want to, one of their biggest issues is how to get their kids to behave around parenting issues. And so we talk about that. Well, what have you tried? What have you heard about? What works? What doesn't work? And thoughts about, these are the kinds of things people suggest. What do you think about that? Do you want to try it? And one of them is timeout, which every mother of anybody over the age of 2 knows all about timeout, or counting to 3, or, red light, green light, that sort of thing. Having some way of stopping the action, cutting, the behavior, and a chance to reflect and talk about it. Well, the group leaders in Sweden were appalled at that idea that we would actually separate a child from other people, either in the home or in the group. Like they would come to sit in the side of the room or something, sit down till we calm down, kind of thing. Because they would never want to humiliate a child. And that blew my mind. I thought, can you imagine being in a country where, your real issue and worry is that you would never want to humiliate a child? It's just foreign to us. So I was amazed, and I was appreciative. Said, so how do you do it? And so one of the things they had was that the group helps the kids to conform, that they help each other. They identify if somebody's struggling, sort of the socialist part of social democracy there at work. Anyway, it's different everywhere, but it's the same everywhere too. And that we got to keep pushing. We got to keep trying. We have to keep, developing things that are going to help kids, that are going to help women. But it's not just about individuals. It's a culture. It's, the community and all of that. So there's just more evidence, from all the talks that we just heard from the panel. Anyway, great stuff. I would urge you to get your police trained if they're not doing this, because you can almost shame them into it. Like, well, of course we need to have upgrades, booster trainings or something, so we can learn the latest thing and really do a better job. I urge you to try for that. But anyway, I'm here now to talk about, using programs that have evidence that they actually work. A lot of people have different kinds of therapy that they do, and they work with people exposed to violence, but they may not understand the risks, the issues, the ways in which their needs might be very different, and how things that are done in an otherwise non-IPV situation could actually re-traumatize or harm people. And so trying to find out what works for a group of people where programs are based on this particular issue, not on a theory, of resolving anxiety or something. We need to find out if it works and if it doesn't work. At the end, I may have time to show you a session of the kids club that I booted up, but let me get back to the program. Evaluation, for those of you who love this stuff, good for you. For those who don't, I'll try to explain it as best I can. But it's very, very, very important to have evidence for what you're talking about. It's one thing we know we help people, right? When we sit with them, we spend time with them, we try to, bring our best tools to, give them resources and all that. But are we really helping them? And so it's one thing, we know we are helping people with our time. I mean, it's a rare person who gets up and walks out, or, but do we know why and for whom it helps? And that's very important. So it's easy to find out information kind of in general or anecdotally, but it's very hard to prove it with numbers. And that's where the science part comes in. So I felt very lucky in my career because I understand these issues from my family and from many other reasons. But I also have the knowledge that I can, create a program, I can evaluate it. So I feel lucky that I can wear a couple of hats here that makes this a good experience. Anyway, I feel grateful that I can do something. So anyway, trying to measure outcomes. This is how we know if there's evidence that a program works for this group of people. Other things work in therapy in general, but for these people, what happens? Okay, so in order to do this, you have to write a grant to CDC to get a lot of money, because it takes about 5 years to do one of these studies. You have to gather enough people who want to be in the program or want to be in this evaluation study. And then we ended up with 221 people. I've been telling you a little about who they are. We have to have conditions or comparative groups. So you have to have a group that gets whatever the program is, and a group that doesn't get that program for that same amount of time. so that you can see if over time the change is due to the program, because they're different experiences, or if it's just due to time. If everybody gets better, the program didn't have a very good effect. If people in the program get better than the comparison group, then it's due to the program. So that's how it gets set up. And we automatically, when I was doing this at Safe House Center, we always had a waiting list because it's a 10-session program. And we'd build up the waiting list and then start another group when we had enough people. So it wasn't unusual to have a waiting list. It was hard to have a waiting list when you're doing a study because you have to assign people. So we took the first 6 people were in one group, the next 6 or 8 people in the next one, et cetera. The 3 groups were those who only got the kids club, the moms didn't participate in a program, and those who got the moms empowerment program and the kids club, and then the comparison group that got neither. Everybody in the study was invited to have another round of the program. So they were in the comparison group. After the 10 weeks, they were in the program. If the mom and child were in it, they could do it again. Or if the child only was in the program, the mom was invited to the mom's group after that. And that was the best we could do. But if you don't have those exact comparison groups, you can't get the grant to do the evaluation. This is what I just said. The randomized controlled trial idea is like the gold standard. It's almost like a medical model when you're trying to test whether your COVID vaccine is effective or not. You have to have groups and you compare them over time. We were able to do this because, as I said, we automatically had this delayed treatment group going in the shelter. So it wasn't that bad, but I was really worried that something terrible might happen with those families before we could get them into the program. But nothing horrible happened at that point. So we took the first 6 kids and put them in one group or the other group. And this was enough so that we could say there would be a significant difference if we found one between the groups. You have to have all these statistical analyses, a power analysis, et cetera. Anyway, this is what we ended up with. So we interviewed everybody before the group started, 10 weeks later, and then we had an 8-month follow-up. And so the child plus mother group, there were 61 DIA, mom and kid. And at the end of 10 sessions, we still had 61, 8-month follow-up, 60. For the child only, we had 62 at 10 sessions, we had 60, 8-month follow-up, 56. So they pretty much stuck with us. But the delayed treatment group, we lost about half of it, but over the 10-week time, they did not want to participate again. Some of these families, some of these people might have just done the evaluation at this time to get some money. But we think that when we help people, they stay in the evaluation. But when you don't, they drop out and go elsewhere. And so we ended up with 221 in these three groups, time 2. And at time 3, they were invited to join the program, which most of them did. That's what it looks like. And it just numbers, no big deal. You know how long it takes to recruit this many mother and child dyads who want to be in a program? Luckily, I had about 30 undergrad students, a bunch of grad students too. They plastered the neighborhood. This was before Facebook time. They plastered the neighborhood with flyers. We went to every social service agency. We went to every imaginable place, doctor's offices, emergency rooms, every place where we thought people might go. We had flyers that went out with the police. And this was in Washtenaw County, in Detroit, East Detroit and West Detroit, which are like 2 different countries. We were in a small group of them were in Southern Canada. We were in Jackson, Michigan, at agencies that serve the needs of abused women. And they were social service agencies, they were Catholic charities, Catholic social service, they were shelters, it was a whole mix of places. So we pretty much invited anyone who'd had severe violence in the last 2 years to be in this program, to be in this evaluation. And it took a long time. We had to go into certain settings and people would say, here we are, mostly white people from the University of Michigan, going in saying, we have a program. We would be happy to give you all the materials for the program so you can keep doing it. But we'd like to interview people before and after. We'd like to pay them. And that part was very attractive. They really want help, a program that might work, but they don't know us. It took a long time and a lot of meetings together to get us to get to know the neighborhood. We knew some of the shelters, some of the places. And in one place, they said, well, you can work with our kids. That'd be great. But first, you have to paint our rec room. And I thought, okay, done. So we all put on Michigan t-shirts. We had a whole bunch to give away. The university gave us. And we spent a Saturday painting that rec room. Another one in Jackson, Michigan, they said, well, we're trying to write a grant. We need to get an extra building so that we can have our, programs for this and that. And I said, well, I write grants some of the time. I don't like it, but I can help you. And so there was, getting to know you, getting to trust you. That took a lot of time. And, we were here to help, and I think they could see that. And, the women in this panel were talking about, who do you trust? Who do you tell? Do you bother to tell anybody anything? You got to size people up. And I think they do. When they make a decision, you're going to be okay. Your heart's in the right place or you're not. And part of that is when you join a community, you want to know about it. You don't come in with your ideas. We don't, bring something in and stick it on people. We are there to learn from people. What works? Where are the resources in your neighborhood? What have you tried? What works here? How can we, what do you want from our knowledge or from the last 20 groups we did? Here's what other people said. What do you think? And it's more of a joining, and that's part of the taking a long time. But we never had one woman refuse to be part of the interview, refuse to tell her story. In fact, even some of the poorest women would say, you take this $25 and you give it to someone who really needs it. It was stunning. And people who said, I've never told anybody. This was my first time telling what happened. And so some of those interviews went on a long time. We were going to be there and we're going to hear the whole story. So, and other people, they just answered questions. They were fine. So that's how it went. And that's why it took over 3 years to do this, to put, all those families through the program and to evaluate them and to, come up with all the activities for the kids. It's actually a fun program. They jump around and do things. So luckily I was able to bring this to the community. The community was able to bring their people to me, and we worked together, service providers with some of the students who'd already done the program and were trained. That's how we got into this. And that was the first study. And I've said preschool one, Latina one, Swedish one, etc. All right, so I think I already told you this. Kids were 6 to 12, low income, but people were educated. They had some training or college after high school. Again, half were white, half were some ethnicity, mostly African American and biracial, very few of other ethnicities. I think we had a couple of Native American people in there. So for demographic data, this is what we wanted to know. The age, the gender, the mom's relationship, who's living in the home, how many times have they moved? Housing instability was a big thing here. Their education, monthly income, their child's ethnicity, whatever groups their mom wanted to include, and ages and all that. So this is what we did to figure out. So how do you figure out what is it we want to see anyway? Well, the biggest problems that have been identified in all the research are things like anxiety and depression and attitudes. And so we wanted to figure out attitudes and beliefs about violence, whether they were socially and emotionally competent. Remember that sense of, people in the resilient box, and then their adjustment for aggression, depression, and anxiety. So we asked all these questions of the mom and some of the kid. And the child behavior checklist is really hard on people. It's 133 items. You just mention these things. It's yes or no, but it's very reliable. This means if you ask all the questions under these scales, you put them together, that 90% of the time it's going to reflect whether they have internalizing problems or not. And so these are done over the years. People validate them. And externalizing, again, it's very reliable. It says, it measures what it says it's going to measure. Problem is it takes a long time. But in a research study, you pay people, this time I think we were paying $35 for the most recent study. And you thank them for their time because they're doing an honor to participate. But you need to use the standardized measures so that you can compare what you find, what everybody else finds. So what was our idea? Our primary question was, do the kids in the kids program improve in these behavioral problems compared to the kids who never were in the program? And this is what we found. Those internalizing symptoms are anxiety, withdrawal, fears, and all that. You can see the red line was the child and mom. If they were in the program and the mom was in the program, they significantly reduced their symptoms. If they were in the child-only program, things got worse and they kind of leveled off. In the comparison group, things got worse. So without getting any help at all, these kids are going to have more anxiety, more worry and concern. But if they're in the child program and their mom is in the Moms Club program, they're going to do better. We did better in changing their externalizing symptoms, and that's aggression, delinquency, conduct disorder. Those are the things they get in a lot of trouble for. If there's a super quiet, withdrawn kid, depressed kid in class, that's not so big a problem. But if there's a kid who's disruptive, who's fighting with everybody and making trouble, that kid gets a lot of attention. So this was an important one. We don't want kids to suffer from either. But the same pattern, it gets worse over time if you do nothing. But if you help the mom and the kid, it gets better over time. The number of symptoms are down. Interestingly, if you only help the kid, it still doesn't make a difference in externalizing symptoms. These are serious problems. Now we're going to look at those kids who are in the clinical range, the ones who could have a diagnosis, right? These are the kids who most seriously are in trouble. This is from the beginning of the study to 10 weeks later, okay? We're looking at the change, what percent changed. So the red box is the child and mother program. The blue is just the child only, and the yellow is no treatment at all, the comparison group. More than 65% of the kids, when the mother was also in the program, no longer had clinical range anxiety. Big change. If you only help the kid, about 34% no longer were in the clinical range. But look at this one. If you did nothing at all, 24% of the kids did better. They got better. They healed. They adjusted. But if you help them, you help their mom, boom, you're going to get a big difference. When it comes to aggression, acting out, those kinds of things, a little less than half of the kids were no longer in the clinical range. And this is a life-saving change. If you can get somebody who doesn't need therapy right now, that's huge. They're functioning better, etc. Child only, less so by half. And then if you did nothing at all, I think we got about 14% of those kids no longer were in the clinical range. So this was something to write home about. It got published in our major journal in psychology. But bigger effect was that it helped those kids. And we figured out how with the mother and the kid. This is something about from baseline to follow-up from the very beginning to 8 months later. So the comparison group, we didn't do 8 months. They were in the program then. Now things got better over time, even better. Child plus mother, almost 80% of their problems, no longer clinical problems. And even if it's just helping the child, we still reduced a bunch over time. So part of this is, you help the mom in the program, she's getting a handle on her kids, the kids are behaving better, they're less anxious and stressed out, and their behavior improves. And with the mom's program, we work a lot on what have you tried? How can we help you, manage your kids? Because that's their biggest complaint of parenting is their kids are out of control. So that really shows that over time, this really works. It works in the short run, but it really works over time. And the moms are pretty grateful about that. attitudes and beliefs, and they feel very competent again. They can handle it. Their kids are not as stressful as they were, 10 weeks ago. So things are getting better. Attitudes and beliefs about violence. Kids grow up thinking it's okay to do certain things. It's not a problem if I, fight with my brother, or that it's my fault if there's fighting in the family, or people deserve to be hit, or there's nothing kids can do, or, kids feel angry, and they do. Um, Also, fighting's the only way to solve a problem. Well, we work on that a lot in the kids program. Fighting happens when parents drink. This may be true, but we never mention that in our program. Or fighting caused by being poor. Those are kind of control questions. Did the program even talk about those? No. And fighting is never caused by being poor. So it's a rating scale. It's on a scale of 1 to 5. And the kids have to say how much they believe these things or don't believe these things. So basically, there are two kinds of items. And one of the kinds is that violence is acceptable. It's okay to hit people. Fighting's the only way to solve a problem. Other items show violence is wrong. Family violence is against the law. Kids are upset by violence. It's not okay, in other words. So those are like the two scales. We've tried to see whether being in the program, we could reduce these negative beliefs about violence. Because, if you think it's okay to go around hitting people, you're going to do it. You think it's not against the law, or it's not a problem. It's a good way to, it really works. Then you're going to keep doing it. So if we can change thinking, that comes before changing some behavior. And here's what we found after the program. And there were kids who were in the program and kids who were not. So the red line is there was a pretty good jump in, they no longer believe that they're to blame when there's fighting in the family. But if they weren't in the program, you didn't see any change in that. Belief that people get hit because they deserve it. They deserve to be hit. Kids got worse if they weren't in the program in that belief, and they really changed their thinking on that one. It doesn't mean they changed it completely, or, it's just a little less that they believe it, but that's still something. Fighting's the only way to solve a problem. When they were in the program, we really changed that one. However, kind of creeping back up there at the 8-month follow-up. So that means that you would have to have booster sessions in there to keep that going in the right direction. But the program was very significantly different. So this is the size of the effects of the change. And that means, what's the relationship between having a change occur and being in the program? If you think about effect size, the effect size of connecting smoking to cancer is 0.34. All right. So what's the effect size of being in the kids club and changing your attitudes about violence? It's a lot bigger, 0.45. Or a little, it's almost 5.0. And of course, it's better if the kid and the mom are in the program. It just means we changed their thinking significantly. We made that connection between being in the program and then being able to change your thinking. There was a big change at follow-up. I don't know why the child only got even better in terms of their thinking, where the kids with the moms did not. They still improved over time, though. So that's what we did around thinking and behavior, which, is pretty good. I was hoping at least let one thing come out positive, please, after all these years and all this stuff. Well, what about these traumatic stress symptoms? Remember the video, remember Bruce Perry, remember our study of how many kids had trauma, how much symptoms they had, how they were really and truly suffering. And as the women said in the panel, it doesn't go away. It's not like you're ever not going to be anxious thinking about it or talking about it, but you're not going to have PTSD. That's a big, big thing. You're not going to be dysfunctional to the point where you can't sleep at night. You can't hold down a job. You can't be with people because you're too scared or nervous. So this is very key in terms of, we're trying to promote mental health here. So there was a 17-item scale asking, did your child have any of these experiences following, the worst thing that happened? We didn't go over the items, but here are some of them. What % of kids had intrusive memories? How about nightmares? That was not so common. Acting out perseverative play, 14%. Reaction to or trying to remember as soon as somebody remembers it, they get all upset, 34%. Avoiding thoughts and feelings. This was at the baseline, at time 1. This is what the kids are bringing into the program, avoiding things, forgetting, repressing parts of it. They didn't have so much less interest in things. More things that are important, more irritable and angry. 48% of those kids were more angry and irritable. They have trouble concentrating and paying attention, 42%. About a quarter of them have this hypervigilance, this physiological jumpiness, reactivity. Again, that keeps kids from being able to participate in the ordinary things that kids want to do. And so those were the symptoms. A lot of kids had them. We thought, well, if they're in this program, hopefully we didn't specifically target their trauma. We never said, tell us what happened. And unlike other kinds of trauma focused programs, we never said, write it down, tell us everything that happened, because we did not want to force kids to do that. We have a program that builds them up. It empowers kids to feel safer, to feel stronger, less anxious. And that, we argue, would be related to having less trauma. And here's what happened. If they weren't in the program, nothing changed about their trauma symptoms. If they were in the program, a significant change that kind of kept going over time. So once we reduced trauma symptoms, it stayed. They didn't get more traumatized. We had a number of kids with PTSD. Remember in the study, 51% of the kids. Without treatment, without any kind of help or program like this, they got worse. More kids have PTSD. But with this program, we reduced it a lot. It doesn't mean that no kid had PTSD at the end of it, though. So a program like ours is more, it's a first step kind of program. And if there are significant problems at the end of it, like if the mom's still so depressed she can't get out of bed, whatever, she must get out of bed to come to the program also. But if things are still really bad, then they can be referred to other individual treatments that are more costly, that are more focused. And so for these kids, we could refer them on to get more individual help. But it kept going in the right direction. And so we would just say to moms, if your kid continues to have these problems, if it interferes with their friendships, their schoolwork, their family, here are the places you can go. But the fact that you could even change PTSD in a kid in 10 sessions was news, because no one had ever done that. So that was very exciting. We felt like we were on the way, on the right track. Getting tired. Social competence, that's the one we used to predict these kids who we targeted as resilient. And this is important. How much can you regulate your emotions? And how much are you having these pro-social behaviors? That was social competence in this one. And the group therapist assessed that for everybody. On a Likert scale, I can send anybody any of these measures if you're interested. The group therapists, group leaders, they were grad students and people in the community, service providers. There was a low rating of how competent and resilient they were, but at the end, for all the kids in the program, they rated them very highly. And they were independently rated by the two group leaders. So it wasn't as though just one person was saying it. So this is a pretty good positive outcome on that one. So here's what we found out. Kids Club reduced their maladaptive beliefs about blaming themselves, big thing related to depression, right? And acceptability about violence. They no longer thought that. We reduced adjustment problems, not for every single one, but for most, almost 80%, which again, in 10 sessions, beats the average. The intervention program reduced traumatic stress as well. And that was not, we didn't set out to directly address trauma symptoms, but by doing the kinds of things that we did in the program, empowering kids, developing skills, helping with emotion regulation, all of that reduced their symptoms of trauma. So adjustment was not related to being older or younger, boy or girl, from any ethno-racial group at all. It wasn't related to the amount of violence in the family. So kids who had more violence did better. It wasn't related to income. It was related to how many problems they had at the beginning. Kids who had more difficulty to start did better. And if you think of it, you have a big problem, you can get a change in that problem. But if you don't have very much of a problem, you're not going to see a lot of change. So that made some sense. If mom was very depressed, the kids were, had more difficulty getting change. And if mom became more effective in her parenting, kids obviously became better in their behavior. So the things that really were related to the good outcomes, the biggest outcomes, were how many sessions they went to. And that's an issue in programs because people, it gets to be winter and you have a bunch of kids and no way to get there. Or one person's going to be sick in every family almost all the time. Program attendance, we could help by giving people a bus token, paying for a taxi, providing food for families when they come to the programs. There are certain ways that you can make it more possible for people to get there. The amount of improvement in parenting skill, that was related to the amount of change in the kids and how much we reduce mom's depression. So moms who got better, their mental health improved, their kids did better too. So it's most effective when both the mom and the child, we want to help kids, but we're not going to put them in individual therapy. We want to help moms. And if we can do both together, it's going to help the kid and the mom at the same time. So that's what we found out. And that's why we have both kid and mom or family, however you want to frame that in the programs. Okay, what about the moms? And I will get through this. We might even end early. Nobody argues with that. So maybe we'll stop there for a second, Diana, and see if there are any questions, and then I'll go on to how we evaluated what was going on with the moms.
There are no questions, Sandy. I think we're all just very knowledgeable in this area, so you're good to continue.
Excellent. All right. So for the mom, we wanted to see how much she was exposed to violence, either in the first place or at the end of the program. Our goal was not to make people leave. We had no goal in terms of you have to attain this certain level of skill or something, or it's not prescriptive. It's just a supportive program, empowering people to whatever extent could happen. We wanted to assess life stressors. What are the kinds of things that were distressing, and mental health, certainly. So to measure domestic violence, we used a 54-item measure. There are about 20 ways you can measure this now. But this was sort of the standard conflict tactic scale, mild and severe violence. It was a psychological maltreatment scale. There is the conflict tactic scale revised where you can measure the violence that the partner did to the mom, but then you can also measure the violence the mom did to the partner. Every single agency we worked with did not want us to measure those items. And I agreed. I did not want to be having any documentation of any woman, not that they weren't fighting back some of the time, of course they did. But we did not want to document that because we didn't know, even though we had a confidential certificate guaranteed, nobody could get a hold of the data, but you never know. And I did not want to have to be reporting moms before they even started. So we didn't include those items. But we did ask, did the child see those events? And I already told you what % of things kids did see. We wanted to know too, had they ever called 911? What about the sheriff's data, emergency room, medical evidence? We asked if there was any legal action. We asked if they called 911, been to the emergency room, and if they had, what kind of injuries they had. So there were lots of ways you can get at what is going on, what's the picture, and how bad it is. We asked how many violent partners have they had, how long were they in a violent relationship, etc. And we asked if the partner was the child's biological parent and if they still had contact. And we just heard from the panel how important that is to understand and know that even, as I said earlier today, even if they get a divorce or, they separate, if they're not married, whatever, the kid doesn't get divorced from the abuser usually. I mean, it has to be, you practically have to have it on videotape or with serious injury to take away a parent's rights in that case, even though we all know the horrendous damage this does to kids. And I think, again, if all the police who, are hesitant to make a case could see that video, that Bruce Perry video, or even some of the earlier ones, could really get a picture of what it does to kids, I think, I hope things could be better. But that's ongoing contact. That's an important thing to know for kids. So what about being in a violent relationship? How much violence is occurring in the family from the beginning to the end? And the comparison group was somewhat reduced too. Some of those were people in a shelter. But when they were in the Moms Empowerment Program, it was very significantly reduced. So that was great. We didn't tell them, don't do this, do that. It wasn't like that. But the kids were exposed to less violence too. Here was an interesting one we never expected to find. 8 months later, after being in the program, not one mother was still in an intimate partner relationship at all. And that, again, it wasn't you have to leave and stay out. It wasn't about that. But people who weren't in the program didn't change, but over time, more of them had left too. So if you do nothing, people can get, things change. It doesn't always stay dire. So that was interesting. We didn't expect it. Positive parenting got better if they were in the program. It got worse if they were not in the program. That changed. It wasn't a huge change, but a little more positive parenting goes a long way. We were happy with that. But here was the big finding. Again, I had never expected there to be so much trauma in these kids. I certainly knew the women were. But here's what happened. The comparison group is the yellow, and the red is the Moms Empowerment Program. At the very beginning of the program, 65% of the women had traumatic stress symptoms. At the 10-week mark, when the program was over, fewer women had traumatic stress symptoms when they were in the program, and fewer did too, if they didn't get any help. But over time, they didn't change at all, but things still continued to get better if they had been in the Moms Empowerment Program. So we reduced trauma symptoms, and the reduction held over time, 8 months later. But here was an interesting find. 86% of the moms who had a diagnosis of PTSD no longer had one when they were in this program. And that outperformed any other program that's designed to address PTSD. Trauma-focused CBT has a success rate between these numbers. EMDR has a success rate between these numbers. CBT, exposure therapy, all of these ways of addressing trauma. And I think we did so well here. I was really happy and surprised because we addressed the problems that these people had. When you're in a general type trauma-focused CBT or CBT program, there are very specific steps that are taken for everybody. It doesn't really matter what the trauma was, but a specific program that addresses safety, getting resources, reconnecting to family and friends and, organizations. Those are the things that come along with talking about what happened and, managing fears and worries and getting, healthier. It's the fact that this group of women came together and healed each other. And to me, that's why it worked. Looking at depression, we use the CESD scale, only 20 items. And here we found both people, whether they were in the program or not, had less depression over time at 10 weeks, but later they were more depressed if they were not in the program, but they were less depressed over time if they were. So that was good. We reduced it, but everybody got better. On the other hand, it continued to get better and not worse. So depression was reduced as well. At the very end of the program, we sort of do, consumer satisfaction questions. So what did you like? What worked? What didn't work? What would you change? Please give us your opinion. help us make this better because we're going to do this again next week with a different group. And they really, the number one thing kept coming up. They really appreciated the support from other women. You can do therapy with people, but you can't walk in their shoes. When you are with a group, doing a group intervention, a group support kind of program, empowerment program, you are the resource. All the women together are the resource. So they really loved it. Group discussions were important, like, oh, this happened to you, that happened to me too. Are you sure you're not sleeping with my abuser? Because the same thing happened to me. And they become aware they're not alone. It's very common. These things are done in the same way. And the strategies for how to manage that stuff, they come from people with that knowledge. So that's, it's great. They appreciated the support around parenting because that, again, is their number one issue sometimes, but also being able to consult with the group leaders who can provide information and resources and other things. They found the facilitators very helpful, and they felt that they really gained self-confidence, that they could do it now. They could try different ideas, try out different things with their kids. They had a different way of seeing their situation. So that was very exciting. Okay, what's the bottom line? The mom's program enhanced their parenting, changed their depression symptoms compared to those who weren't in the program, reduced trauma symptoms, more likely to be single at follow-up. We didn't expect that, but they really appreciated the program. And they said, you've got to get this out to other people, or can we sign up again? And we didn't have it going again, but we could say, in this agency, this program is going to stay. So once we went and worked with people in the community, we worked together, changed the program to adapt it to whatever, the resources were. And then we left, we did our times 3 interview, we're out of there. But the programs are going on today. And to me, again, as somebody who's made this my career, because it's very, very important to me, this was a great result. And so it's being able to take the university, bring it to the community, and try to make a difference, try to help people. And we found that we really could, even though we're these sort of nerdy people. But, I don't come from a fancy family. I don't come from a family of great resources. I come from a family with a lot of struggles, and been very, very lucky to be able to go to college and to do this kind of work. So we wish, the whole goal is to, help kids to be happy in the future. And we hope every child can be happier in the future as a result of being in this program. I want to play this for you. I just want to tell you, I was working in Alaska. Again, this program's brought me all over the world unexpectedly. Did not plan on any of this, but spent some time in Alaska with so many wonderful, wonderful people, tribal leaders, people who are running these programs for Native Alaskan women and all Alaskan women in about 5 communities there when we did our evaluation. And one of the things I learned was that there are public service announcements by children about domestic violence in Alaska, where the rate is something like 70%. So they're taking a bigger approach, public health approach, but trying to use programs that will help, and including people in tribal and positions, stakeholders basically, in the programs, and adapting them, making them a little bit different. But I learned from them so much about the needs of the community, how to approach these issues with mixed groups of people, some Native Alaskans and some not. But I really loved their public health approach, doing advertising on television, radio, etc., billboards about domestic violence. And here, using
When I am an elder, I want to see children learn.
Okay, hold on. Using the values of their culture, of Alaska Native culture, they're making a pitch to help people see the issues. Anyway, let me see if I can get that back. Hold on. Okay.
When I am an elder, I want to see children learning our native language.
I want to hear children saying nice things.
When I'm an elder, I want kids to be happy and healthy.
I want to feel safer.
I want to see people dog mushing still.
When I'm older, I want blueberries.
I want everyone living a healthy lifestyle.
I want to see a world without violence. Stand up, speak up, Alaska.org.
Love that little kid. That's so great. All right. So that's it. This is my email. Send me any questions you have. I'll be happy to share information. I don't know if I can share these PowerPoints because they're being recorded. You can send emails to Diana about that and figure that out. But I wonder if now that we're drawing a close to the day, it's been a very, very long day, but lots of info. If there are any last questions, comments, questions about whether you could do this, how would this work in your agency, or anything about the program or the evaluation.
Yeah, while we wait for questions, I did want to mention, I'm sorry, I don't know if I did at the beginning, here at the Family Empowerment Program, this is the curriculum that we use. And we just started these services in April. And at the end of the year, we're expecting to have 5 support groups who have completed services. And yeah, we got this training at the beginning of the year. And so to have it again, 6-7 months later, it's a good refresher.
And in the training that we did earlier, we go through each and every session of the programs and give examples of kids' drawings, of their activities, of kinds of things that they did in the program to get a feel for what you could do in your setting. And so by the time the program begins, I think people feel like they have a good idea of what it might be like, and then we find out how it went and make plans for the next week as we go along. So it's been great to work with Diana and her team.
It's been great to work with you as well. We have one question. They asked if this video will be sent to them and if they can share it with others in their area of service. And yes, we will be sharing this recording with everyone at a later date, not today, but in the coming weeks. And then another question was, did you have males conduct the kids club sessions and how did it go?
That is a great question. If I could only get enough males so that we could have a male leader and a female leader, it would be perfect. But as you know, we just didn't get that many males who wanted to be group leaders. A number of the graduate students were males and they became part of this program. Also, several undergraduate males were group leaders for this program, and the kids absolutely loved it. But they were very rough on these males. The kids were sort of testing them. They were jumping on them or, kind of pushing them. They wanted to see, how is this person going to react to me? How is this person safe? What's going to happen here? But they absolutely loved having a male in the group. One of the guys, Josh Cohen, his name was, he had a guitar and he brought it into every session. The kids really loved that. He particularly around the session of, it's never the kid's fault when the parents fight. And he brought in his guitar and he made up a little song about it. And he sang it every single week and played the guitar to the kids because they insisted he bring it back and play that song every week. And it was like, I know what's wrong, I know what's right. It's never the kid's fault when the parents fight. Not a singer, but it was like that. And they just sang it over and over and over. They loved it. And it just hit home with them. It's not my fault. That was a great, great moment. So yeah, it would be great if we had more male group leaders. We've had some men be group leaders for the moms program because that's who is available to do that work. And a question again, people take you as you are. They see if you're a good person, if they want to trust you, if you can be helpful or not, and go from there. But they really loved having men as group leaders. So.
Yeah, we have one male on our staff, or in the same department, not the same program, and he covered childcare for us one day, and was a complete hit. I don't know if he's still on this training, but shout out to him. There's another question. It says, is there a specific quote unquote distance from crisis that this program is most appropriate for? For example, is it more effective for families a year out of crisis than those who are actively in crisis or still
That is a
experiencing the abuse?
Right. That's a really good question. And I worried a lot about that before we started because I didn't know what to do about it. One of the things I did realize was that even if people are no longer in a violent relationship, they could very well get in another one. Even if they left an abuser, they could very well get right back with them 2 weeks later. It's not, that's a wobbly line. There's no hard line where it's over. And so I decided to open it up to whoever wanted to be there. And in many settings, it was done in the community. Anyone in the community could, be in the program, be in the evaluation if they wanted to. And I found over time what was really cool about it, what the group of women, they were never in one place, like they'd all left or they'd all just started or they're all with an abuser. They were all over the place. And it changed even during the course of the program. So it was actually a really good thing because we had some people who they were going to show up at this group, but they didn't want to be pressured. They didn't have any ideas about leaving. They just wanted information. And then other people had already gone out. People had gone out and come back. They weren't quite out yet because it took, many tries sometimes. People who've been out for a while, but it all had to be violence within the last year or two. So it was people who really were recent survivors or people still experiencing it. And they could help each other. They could give information to each other. Well, here's what I tried. This is what never worked for me, but here's something that really worked for me. And that kind of knowledge, that group knowledge that they could share with each other. And I was scared too when I first thought of that, they might say, and here's what I did to feel better. Or here's the 5 things you really need to do before you try to call anybody. And that kind of valuable knowledge wouldn't come from people who had never left or people who are, it was great. So, in my opinion, open the door. People need the help. Whoever can come in my opinion, that's who needs to be in the group.
Yes, thank you, Sandy. I think we had that conversation when we were first starting our program here. And yeah, that's what we did. And our initial groups were for post-crisis survivors, and they were somewhere in their journey. But this most recent group that we have is for just so happen to be for moms who are currently in those relationships or in those situations. And a couple of them are taking steps to leave their abuser while they're working with us. So it has been very interesting to see them empower each other in that way.
Yep. It's working well, it sounds like.
Yes, and I don't see any other questions. So I think we might get to leave 15 minutes early, if that's okay with everyone else.
I don't think you'll have any argument after a very long day.
I lied. One just came in and it says, what is involved in implementation and fidelity monitoring?
Yes, that's a really good question because when you develop a program and you're running it yourself, you know what it should be like. You know whether it's going right or not, whether it's going according to the training manual, etc. But when you work in communities, you are not the person doing the program, not even the very specific people you've trained. You're training others who have other levels of knowledge and types of knowledge, like local knowledge. And so it can be very different. So that's why we have a training manual. It's like a very thick book, and it describes, how you set up the program, why things are set up this way, but also what you do in every single session or what you can do. What are the materials you need? Here are the goals and the aims. Here's the research behind it, why you would do this. And then examples, 3 or 4 examples of groups that have done this and their process notes. So a couple of pages, like a written description of what happened in that session. When we do the program, we have consultation where people, when we are evaluating a program, we have the group leaders have to rate on a scale of 1 to 5, how much did this session adhere to the training manual, particularly for the kids, because the women's groups, they talk about everything all the time. But for kids, there are specific goals for each session. So how much did they adhere to it? To really get fidelity, you have to videotape and then code it and see if it's exactly what you're supposed to do. Well, you could never nobody would show up if they were going to be videotaped. So that level of fidelity is never going to happen. But the two group leaders rate the session independently. How much did this session conform to the training manual? And then you can see over time, and we get about 95% of the time the session was led as planned. All of the aims and goals were met. There might have been incidents or issues here and there. Part of the training manual includes description of, so how do you manage it when this happens or this happens or this happens? So hopefully by training the group leaders and then having that consultation where we talk about, so how did it go? What got in the way of making this work? What did make it work? What was really great? Well, when the one kid who was the most popular said, okay, I'll make a puppet, everybody jumped in and did it too. We find out what worked, what didn't work, but did it conform to the program as we expect it to go? That's the best we can do for fidelity, and those ratings are very high, even in other communities in other countries, for example. So hopefully it's something doable and that you can pretty much pull it off in your setting and it will match what it's supposed to.
Okay, that really is the last question that I see. So thank you again to Sandy and everyone else that joined us today. It's the first time that the Child Saving Institute, the WCA, and Survivors Rising get together to host this type of training. So if you haven't done it yet, if you could go to the chat and fill out the quick survey, just to let us know how it went, any input for next time. And yeah, thank you, everyone.
Great. Thank you, Diana. It was wonderful to be part of this. Good stuff. Bye-bye, everyone. Thank you again.
Bye, have a good one.
Yep, you too.